Let's talk a little bit about what's going on with the dialysis program.
Yeah.
I know that Prairie Lakes, was it, that had
Correct.
the dialysis here, opted to discontinue their services.
Yes,
Okay.
yes. So I'm glad you brought that up, Julie, because I've had fielded some questions because I think I've had questions. Well, did Ortonville drop the dialysis service?
Right.
And that's not the case. And so for about 20 years, Prairie Lakes has leased space, rented space out of the RSR clinic area, and provided dialysis. And, that was back, Bob Flieger made a donation at the time for our dialysis chairs, amongst others, with the foundation. But I know that Bob Flieger really was one of the pushers to have dialysis in this area. And as a personal note, my wife's grandmother needed dialysis. And prior to Ortonville, she was traveling to Montevideo each day to receive dialysis.
Oh, that's a lot of time spent.
It's a lot of time spent, and of course with dialysis, you have to travel, you have your run, and then you go back home, and then you kind of physically feel drained, you feel achy, kind of fluish, and so being on the road and not feeling well is not desirable. So it was great when we had dialysis service. A couple of years ago, Prairie Lakes approached me about maybe, discontinuing dialysis services, and we, kind of negotiated back and forth, and then they continued to do dialysis services, and then last winter, the reverse osmosis machine went down, and that required pretty expensive repairs. And then they found out that it was going to cost Prairie Lakes about $500,000 to actually completely replace the reverse osmosis and system. And so also Prairie Lakes, because we also did analysis of can we bring this on ourselves as an organization. And because of dialysis and because of the number of patients, they were losing about $200,000 to $300,000 per year to provide that service. And so for us as an organization to do that, we'd have to put $500,000 up front just for the reverse osmosis system.
Right.
And then also, staffing that, which has a number of challenges, and then losing money because you want about between 15 and 20 patients to make your dialysis system to be kind of a break-even point.
Okay.
And we had 4 that were on dialysis at the time. And I had a conversation with one of them. And again, from personal experience, I know how that affects individuals. And we did do, again, we did an analysis. We looked at some different systems and other options for us to bring dialysis in, and it just wasn't feasible for us. And so, it was because of Prairie Lakes backing out, mainly due to the expenses for that. And again, it was a service line that we couldn't bring on ourselves. So.
Okay. I was going to ask you too, and maybe you don't have an answer for this one yet. The change at Prairie Lakes in Watertown.
Oh, yeah.
How, if at all, will that affect OAHS?
Actually, I don't think it's going to. It's not. It's actually had a beneficial effect, and I'll mention that in a second. What I know of Prairie Lakes joining Sanford Health is this is going to happen January 1st. There isn't going to be any name changes initially, but I think as systems get updated, they'll eventually switch over to the Sanford signage and name. But I don't. I'm not aware of any timetable. I'm not aware of. I think they'll still call it Prairie Lakes Hospital. I don't foresee them changing any of that. But because they are part of Sanford Health, our health insurance for our employees is Sanford Health. And so actually it's going to cost our employees less for those specialists that come to our hospital. So think of Dr. Garish and Dr. Schaefer, who do colonoscopies and do surgical procedures. They'll now be in a lower tier for our employees, and so there'll be less expense for them for that.
Okay.
And so and I'm hoping that maybe eventually could we bring on some other service lines. I would love to have dermatology here.
Yes.
But dermatologists are hard to find because there's not many of them, and they tend to be in larger cities, and they're booked solid. But I think there might be opportunities in the future for that, and certainly I'll advocate for that.